while we have eminent medical oncologists and also, the hemato-oncologists, so my question is to Dr. Singhal first, is where would you really choose a proton therapy over a radiation therapy? In your, I'm sorry for this question, but then for audience, because they'll go back and they would want to know.
So I think there are very clear indications of proton therapies. One is childhood cancers, definitely. I don't treat childhood cancers, and especially where re-irradiation is concerned. That is the place where it definitely meets the cost-effectiveness ratio. Because of the cost constraints, we are not able to advise it to everybody, but if, say, the proton was available at the same cost as the photon, then perhaps we'll be doing proton for everyone. But that's not the case. Right. But certainly where re-irradiation is concerned, we definitely take opinion of proton colleagues at that point in time. So and somebody who has received radiation in the past, and somebody where radiation is being done in a curative setting, not usually in palliative settings where, because then the cost versus the benefit ratio is not matched in palliative settings.
May I just respond to that? Yeah, so there are certain situations where you may question whether toxicity reduction is a reason enough. However, there are certain indications where the outcomes are better. For example, skull-based tumors, paranasal sinus tumors, skull-based chordomas. We have now enough meta-analyses telling us that the outcomes are better with proton therapy.
Chordomas, they don't come to us because that is not a tumor which is treated by chemotherapy or medical oncologist. So I'm talking of the more garden variety and routine tumors which we see, like breast and all. So in those patients, say for example, there's a breast cancer patient, curative setting, which has already on the left side, which has a cardiac ejection fraction of say 20%, and you still want to do radiation therapy. Perhaps that is a type of patient where proton will definitely score above photon therapy.
Right. And Dr. Bhargav, any of your patients you feel in liquid cancer, so to say, if it's not the solid tumors, you would need a proton therapy at any stage?
I think in hematology, there's not much of a need for a proton therapy, but people, it's good to know that because people do ask you, still out there, when you go to Gorakhpur or when you go to Patna, people still ask, as a hematologist, that do you consider proton therapy for brain tumors, for head and neck cancers and other things? But for hematological malignancies, no, probably. Our more focus in hematology is towards bone marrow transplants. And that's what we think, that if you risk stratify them well and early, that's where you need to spend money. Believe me, you test more, you gain more. पहले लोगों को लगता है ना टेस्ट करता है तो डॉक्टर के पास पैसे जाता है. अभी मैं कहता हूँ डॉक्टर के पास जाए ना जाए, तेरी जिंदगी जरूर बच जाती है टेस्टिंग से. तू अपनी जिंदगी सोच. So I've been telling this on top of a voice from every podium. वो 5,000 लोगों को 1,00,000 लोगों को. मैं कह रहा हूँ मेरा छोड़ दो और अपनी चिंता करो, क्योंकि टेस्टिंग से, जीनोमिक टेस्टिंग से ये पता चलता है कि आपको किधर जाना है और आपका क्या आउटकम निकलेगा. So that's what in hematology, basically not much of proton therapy, but it is exciting to know that these technologies exist so that tomorrow if they become less expensive, they provide you with a better care and the outcomes and less side effects. किसको side effect चाहिए? डॉक्टर नांगे ने सही कहा, head and neck ट्यूमर के बाद आप सिर्फ इमेजिन कर सकते हो. जिसने उसको नहीं झेला वो सिर्फ सोच सकता है, कल्पना कर सकता है, और शायद कल्पना भी नहीं कर सकते कि वो हेड एंड नेक ट्यूमर की रेडिएशन के बाद क्या हालत होती है. मुझे लगता है कि ये टेक्नोलॉजीज इंसान को कैंसर को हराने में मदद करती है.
So once treated for head and neck cancer, of course, the quality of life dips down very drastically. But people have to acquiesce with fate and comply. Like, there's nothing that you can do, and they keep coming to your OPDs, and after a certain while, they will stop even complaining because they know that doctor के पास कोई solution तो है नहीं, तो बार-बार क्या बताना है.
So I do believe that that's a very important point that you made, Manish. That's a very important point that you made. That it was a given that, well, you had radiation, you will have side effects. And now there is a technology, and at some point of time, if we keep the cost aside, there is a technology that reduces the side effects of treatment. It has to be acknowledged.
Right, yeah, absolutely. We take the point there. But then, Dr. Nange, I have a personal question. Because when we see medical oncologists treat, we come across, things like which is, guidelines. So many times we don't see proton therapy as a part of the guideline. Even in few cases, oncologists here would agree that at times, even in centers, we don't get, approvals for immunotherapies or few frontier, applications which we have on newer novel therapies in our, let's say, with the public sector undertaking and so on, because of its cost prohibitive and so on. But at the same time, talking technically, we have been given to understand, please, we'd like to know your viewpoint, is that usually it is when you have normal tissues in close proximity to the target which we are looking at, which is tumors or lesions. That is the time we have to look for something like proton, and it's not otherwise.
So, as I said, it's colored by the cost. Otherwise, who would like their mucosa irradiated? Why would I want to get my buccal mucosa and my throat mucosa irradiated if I could avoid it? But yes, at present it is colored by cost, and that is worldwide. However, having said that, there are certain situations where it has made it to the guidelines. For example, the NCCN guidelines for certain thoracic tumors, like thymomas, already talk about proton. Paranasal sinuses, pancreas also, they talk about proton. Hepatocellular carcinoma, I'm not sure it's made it to the guidelines in the West, but in Japan, Korea, where hepatocellular carcinoma is a major public health issue, they are the most common cancers that are treated with proton.
And sir, it is definitely making way into the NCCN guidelines.
So that's
also
what I think, Dr. Nagia, I'll pick up from a statement from a talk that proton therapy is going to be the futuristic radiation therapy. But then I have one last question while we were looking at people, I was speaking to them. There's a question that came up from the audience. I don't know if that gentleman is here. But then the proton therapy treatment, people think that it also generates neutrons as byproducts. So do you think that it can be scattered to the adjacent normal tissues and cause, does it have
so those are the older generations, those were the older generations of machines, they were called passive scattering and uniform scanning. We don't use them anymore. They are still there in certain centers in the West, because older machines which are like 20, 30 years older are still being used. However, the newer technology, what is available in India and what are the new installations over the last 10 years have all been what is called the pencil beam scanning technique, which I demonstrated in a video, where there's a 3 millimeter pencil of proton which is going and literally coloring the tumor, right? So in that, neutrons are not produced in any excess amount.
Thank you, ma'am. Thank you. It was really wonderful.
Thank you very much.
So we'll just conclude the session by telling that, it was a really interesting session. Post-lunch, sessions are always quite dull. In fact, it was Dr. Rahul sir who really made it more interesting. Not only by telling in, Aja mere gaadi mein baith ja, he also made all of us sit in his class. Really nice of him. And he also ensured that all the lights were on so that no people would really sleep across. Really, thank you, sir. And it was really, enhancing for us. And also Dr. Manish sir, he was very, enlightening in telling about the importance of prevention, how prevention is very important. And also told about the importance of Mediterranean diet, everything regarding the vegetables, the fruits, what to avoid, what not to avoid. Alcohol also, in fact, we told about what is important, how much we should really consume, what is the minimum consumption. Usually doctor don't recommend that, but still he was able to kind enough to tell on that. And also Dr. Sapna madam, he was really good enough to tell about the importance of proton therapy. And in total, it was an excellent session. I really thank all the three speakers for this excellent session. Thanks to you all, sir.